Bringing a new life into the world is generally portrayed as pure joy, but for many parents, it comes with unexpected struggles like anxiety, exhaustion, and depression. Perinatal mental health conditions, including postpartum depression, affect up to 1 in 5 mothers and prevent many from getting the help they need. Today on The Health Exchange, we're shedding light on the realities of perinatal mental health and the support every parent deserves. I'm your host, Dr. Dorey Rutland, here alongside our guest co-host, my wife Dorey, and our guest, Dr. Katayune Kaeni, aka Dr. Kat, a perinatal psychologist and host of the Mom and Mind podcast. My first question to you, Dr. Kat, is when people say, if you're out on the soccer field, if you're out in life and they start talking about perinatal mental health, like what comes to mind?
Most people think of postpartum depression first, or some people have heard of the baby blues, but there's really so much more. So many ways that perinatal mental health can impact a new parent and a new family that people just are not aware of. So the first things I think of are like, ooh, we really need to be talking about this more because there's so much to know so that people aren't suffering in silence, because a lot of people do.
Everybody has their passion and motivation for doing what they do. How did you get there?
I experienced postpartum depression, postpartum anxiety, and postpartum OCD after my first. And I was already a psychologist in the field, had been working for a while, and I didn't know what was going on for me. It took me about a year to figure it out. Now, I'll say that I had some sense that something wasn't right, but because the pressure is so high to feel like, this is what you're supposed to be doing and you're so happy and whatnot, it made it harder for me to recognize what I was going through, because I thought, well, okay, maybe I'm just supposed to feel this way and I'll just keep it to myself.
We were talking about it this morning. Remember, we were talking about perinatal mental health and things like that. That never even crossed our minds when we had our two, right?
No, I mean, that was 10 and 12 years ago. And I think at the time, the only thing I remember is sitting, just having a baby, or maybe this was even right before, but they put on this 1980s video, and basically the only takeaway is don't shake the baby. So that's all I know. I didn't know anything about postpartum depression, nothing.
After reading about it over the last several weeks, do you think that you had any of those things going through it?
I don't know. I mean, I definitely didn't know enough to even talk about it or even think about it. Part of me was definitely exhausted, and no offense, I didn't know if I was just mad at you half the time or what. But
that might be a sign.
It's a struggle.
All right, so this is going to be a different kind of episode. So when you think about, thinking about what people present with, or how somebody who just had a baby would present, what are the top 3 things that come to mind? What should people watch out for?
Oh, well, it can get a little bit confusing because for about 80% of people, baby blues is a really common and normal experience that people can go through in the first couple of weeks after delivery. But it's kind of like you can still kind of feel like yourself. You can still have a bit of a sense of humor, even though you might be exhausted, you might be tearful, you could have some emotional ups and downs. But if that is more than just mild during that 2 weeks, or it lasts longer than 2 weeks and is persistent, then you might be looking at something like postpartum depression or anxiety or any of the other perinatal mental health conditions.
Defining the 2 conditions, you've got baby blues, like you said, 70-80% of women may experience that. And then you have postpartum depression, and the major difference is just length of time of the symptoms.
Duration and intensity.
Duration and intensity.
Yeah. I mean, other things can be happening during those first 2 weeks that can be much more intense. It's hard to tell in the first little bit of time what's what.
When we think about postpartum depression or postpartum OCD or postpartum anxiety, all of those things, how should couples approach this? What would you suggest we would do if we were to have another kid and the kid was about to be born? How do you support a couple through that?
I mean, being a therapist, my bias is like come in and get some support from a therapist, not just for therapy, but for postpartum planning. So, yeah, we plan for birth and kind of plan for birth and all those things, but really planning ahead of time for how are you both going to get sleep? Who's making food, who's bringing food, like the essentials. Sleep and food are necessary, and those are really hard things to navigate when you're exhausted and, you're like ships passing in the night. So planning ahead to make sure that you have as much support as possible. And for, people that could be different, it could be family. Family might not be supportive. It could be hiring help. Whatever your means allow and what your community can do to support you is really, in some ways, preventative from things getting worse if they're going to happen.
I was kind of thinking about that actually, how I would maybe do things differently if I went back. And I'm like, you know what? I might just have a baby shower and put on my registry that I want like a food service.
Yeah,
I want like somebody to come over once a day or every other day so I can take a little bit of a nap or, even therapy sessions or something like that. Because there's so much stuff that we get that we never even use.
absolutely. Yeah.
When a couple's going through that, I mean, again, for me, like I'm just sitting here thinking about it, and my job was a little bit different. I was still in training,
Mm.
and as a guy, you get like a few days off, and then you got to go back in to work, right? And at the time, you're in the hospital all the time. I didn't even like think about any of this. My wife was like the same way. She was like, "Oh, I got it." I would sleep in the other room, like, and she wouldn't have any sleep, but I would get sleep because she kind of she put me first, but I don't think should have all the way been that way, but she did do that. All of these things, like lack of sleep,
Right.
contribute to.
Oh, for sure.
Well, I think as women too, like we have this mindset that it's like if we're not completely selfless, then we're
Hmm.
selfish.
Hmm.
So we have to get past
Yeah.
that mentality.
Yeah, that's actually one of the contributing factors is this societal pressure, 'cause sometimes cultural pressure, that you're supposed to just set yourself aside and do this like almost martyrdom of sorts, just pour everything into this new being. And there's nothing inherently wrong or bad about putting that kind of effort and energy in, but where are you? And that kind of losing of yourself is a big part of what people experience when they're having symptoms like depression or anxiety. They just have lost themselves in the midst of this big life change.
Dr. Kat, when we were talking earlier, you had mentioned that your experience, so you're a psychologist, you had your first child, and you started having all of these symptoms that are characteristic of postpartum depression, and that motivated you to explore the field and even treat individuals who go through it. Can you tell us about the details of what you went through that pushed you through that?
Looking back on it now, of course, I can, and knowing what I know, I can see that it might have actually started at at the tail end of pregnancy. Some feelings of anxiety, like I was very worried about what was on my registry, and it like all had to be organic, and there could be no toxins, and like okay, that's great, but I felt some kind of way about it. After my daughter came out, she had it was a very long labor, but she had inhaled some meconium, and so she was spitting up a little bit, and that as soon as I saw that, I was just, like, laser focused on her. It was like a hypervigilance that I have never experienced, constantly watching her, and that was how it went for the longest time. The level of vigilance wasn't just like, "Okay, I'm gonna check on the baby, make sure she's okay, and then, go on about my business." An example that I've given before, just to highlight what the anxiety was like, is, I had her in a co-sleeper. She's right next to me, literally could just touch her. And I had the baby monitor on, with the receiver next to her, right next to her, and the speaker next to my ear, just in case I couldn't hear her right next to me. It was like a singular focus that I had to make sure she was breathing all the time. I'd wake up in the middle of the night and check, that this really intense level of anxiety was just constant. Because that is exhausting, it eventually led to depression. Just the intensity of stress and the overwhelm um, became just all encompassing and kind of swallowed me whole. Like I said before, the pressure to pretend like everything is okay was also there. So I was in this sort of like dichotomy of this feels horrible. I'm scared all of the time. And I'm supposed to pretend like I know what I'm doing. I've figured it out, that this is easy even when it just wasn't. It was about a year in when I finally kind of got honest with myself. If you've ever given the PHQ-9, it's a depression scale. I was giving that out to everybody. Every day at work, I was giving it out to everybody. And I was like, all right, I'm just going to sit down with myself. I'm going to take this myself and be as honest as possible. And lo and behold, moderate to severe depression was like the screening score. And I was like, okay, that's the reality here. So that prompted me to look into getting help, going back to therapy, talking to my doctors about what some of my options were. And, there's so many other things that happened along the way that were very intense. The OCD, the kind of obsessiveness about checking on her breathing. By the end of a year, when I finally saw, I got a book, like a workbook on pregnancy and postpartum anxiety. And I read in the book what I was experiencing. And at that moment, I was so relieved that it wasn't just me, that like somebody who didn't know me had written this down here. And it was just as plain as day. Like, oh, that's what that is. I'm having intrusive thoughts about harm coming to my child. Oh, okay. From then on, actually, I got really mad that I had never had training. No one ever really told me about this. I had to figure it out myself. And I thought, okay, if I'm a psychologist and I'm helping people, this is what I do. How are other people figuring this out? Supposedly I have all these skills and I'm supposed to know what all these symptoms are, but I didn't even recognize it in myself enough or want to be honest with myself enough to really see what was happening.
At the time when you were going through this, did you have a spouse?
Yes.
Is there something, this is like a total selfish question, but is there something that you would hoped your spouse would notice or would have done maybe to help support you along the way?
Well, for one, I was really good at faking it. So, like very good. So,
Don't fake it.
yeah. So like pretending I was okay. Thanks to childhood trauma. I didn't want to let him know either that I was having these thoughts because they were so worrisome to me. Oh my gosh, if he knows that I'm having these thoughts, what is he going to think? How's he going to respond? I don't want him to think I'm like losing my mind. So I just kind of kept it in. If I were to redo all of it, I would educate us both on the signs, on the symptoms, on what it looks like and what it can look like, so that he would be able to pick up on it and we would have a plan so that he could say, oh, I think the thing is maybe happening. Like, what's our next step?
Thanks for sharing that story. I mean, when I sit here and think about it, all these things just play in my mind now. I'm thinking about every single friend of mine that's been pregnant has gone through it, and I'm like, oh my gosh, I need to ask these questions. What do you think about that?
I mean, I think also the way like your significant other approaches you is important because I think you're like super vulnerable. Maybe you don't want to admit
Yes.
that you have anything or anything is wrong.
Yeah, I felt some pretty intense anger. That was also a part. I had some rage in my postpartum, like to the point where it was so intense that I.
I'm
you
sure
guys see
he's
that
thinking,
look?
"Oh, she
Like,
has some rage
did you?
too."
Did you? Oh my
I'm just gonna say it for you.
Uh-huh. It's there. It happens because there's such a heavy mental load, emotional load, physical, like everything is weighing on you. And if you don't have a clear outlet, if you don't know what's happening, it builds and builds. And I remember being in the kitchen one time thinking I could just put my fist through the door. It was that intense. I did not do it, but it came to be at such an intensity that it was scary for me. But also he didn't know what was going on. He wasn't, trying to do anything to not be supportive. It was just like this thing we were both in. And I don't know what he was going through at the time. Like men can experience postpartum depression too, and sometimes for men that looks like withdrawing and like going and all of a sudden he wanted to learn how to play bossa nova, like guitar. I'm like, all right, go do that, I guess. But that might have been one of his ways of coping, or like going on 100-mile bike rides. Okay, like I'll support you to do that, but at the same time, it could, like, guys just present in a different way. They experience their own symptoms in a different. I'm not saying you had anything, but um, or I'm not suggesting anything, rather. But yeah, men don't know what's going on either, so it makes it hard.
I was like, did she just end that in the period? She said, men don't know what's
Period.
going on. I was like,
Yeah, yeah. No, yeah, with parent, I mean, we're just none of us are really educated well enough to be able to pick up on it, and be able to say the right things in the right way. That's not gonna, when you're already feeling vulnerable, not gonna kind of pick on something that already feels raw.
When people ask you what causes this, what do you say? How do you answer that question?
Well, there are a lot of things. Kind of looking at a biopsychosocial model, there are certainly biological factors. So, if you or anyone in your family has a history of depression or any mental health condition whatsoever, even in your parents, grandparents, for that matter, is a big factor. There's some of those conditions are inherited and can play out. I think some of the challenges that not all of our parents knew if they were experiencing depression or anxiety. They called it something else, or they didn't talk about it at all. So it's a little hard to get that history. If you in your own life have had trauma of any kind, really, but certainly ones that are of the more vulnerable natures, when you become a parent, sometimes these things, even if you've worked them out in therapy, can kind of come up again in new situations and new scenarios. Um, so sometimes trauma can resurface after a baby is born. That's some of the psychological factors. And as I mentioned before, there's all these societal pressures. This is what your body's supposed to do, and you're glowing, and all these like really kind of hyperbolic, things that make motherhood and parenthood sound like it's supposed to be amazing and wonderful all the time. It's too much pressure. And we have, all of us, I think, have internalized that, and it just kind of lives in there somewhere as part of the social pressure.
A quick lesson for individuals out there, and you guys have heard me talk like this before, right? The body is about cell communication. And yes, there's environmental, there's genetic, and then there's scientific factors. And when you think about cell communication, as I've always said, there are molecules that are floating around in the bloodstream that bind to certain receptors. And when you look at depression in general, and even postpartum depression, there are some biological factors that play a role. Not all, not the entire role, but there are. Again, and what you heard Dr. Kat say earlier is that males can have postpartum depression, and they can. And when you look at the molecules that are involved, what we're really talking about here is we're talking about estrogen and progesterone in females, and we're talking about testosterone in males. And when you look at these hormones, which are molecules that float right across your cell membrane and bind to their receptor, what they actually end up doing, they upregulate certain molecules that make for a better mood. Like there's certain receptors that we call serotonin receptors, or certain molecules that are called serotonin, right, that end up affecting your limbic system, which is the system in your brain that's responsible for your emotions and things of that sort, right? When you look at testosterone, it does the same thing in a male. And so again, this isn't the primary factor, right? And when you look at the studies over the course of time that have been done, it's not, oh, this is the only biomarker. That's not the case. But we know that when a woman is pregnant and you have high levels of estrogen and high levels of progesterone, and then you have the baby, those levels drop significantly. And when they drop, we know in animal studies and in some human studies that that can contribute to the clinical condition that we're discussing right now. We do know that, but then there's a host of genetic factors, as you said. There's a lot of genetic polymorphisms that exist. And so again, when you think about the body in general, when you think about how perfect cells have to be and how perfect molecules have to be to lead to an optimal function of your body, it's such a gift to be here, and it's such a wonderful thing to watch it. But again, scientifically speaking, some of these molecules, you get an imbalance and it contributes to things. And it's just something to think about, something to discuss. And this is what can lead to some of the diseases that we're talking about today.
Yeah, for sure. I mean, I don't have the numbers, but there are some studies that show drops in testosterone for men or is a contributor, for sure. And part of when I'm doing an intake with somebody who's coming in for therapy is I ask them like, what's the history of your period? Like, are you sensitive to hormonal changes? Because that's a factor. If they already know they have a PMS or PMDD and they're coming into this experience, and the likelihood is that they'll also have big shifts. I mean, I can't pop open the hood and look inside and see what exactly is happening, but you can use their history to help inform and educate them on what's happening to them now.
One of the reasons, and I don't know if you came across this story or not, but one of the reasons it's important to address is because individuals that are going through depression, this has a enormous effect on the child that they're raising, right?
Yeah, it can for sure. We know that untreated perinatal mental health conditions can have an impact on attachment and bonding for sure. If specifically if the just speaking of the mom or the primary caregiver is withdrawn or detached and not paying attention to the baby's cues, which could include, feeding or any kind of other regulation they might need. That does have an impact, as well as anxiety. Sometimes when there's such hypervigilance and parents are like constantly on baby and in their face, babies can become overstimulated. So, I mean, if that's happens here and there, that's not what we're talking about in terms of impacting development. Untreated perinatal mental health conditions, if not addressed, can actually peak in symptoms at around 4 years. And so if we're talking about 4 years of somebody dealing with, let's say, rage or high anxiety or depression, it is probably having an impact on the parent-child dyad. It's one of the things that I looked for and we talk about in therapy is, I mean, I'm seeing people primarily online right now, but I want to see how parents are with their baby, because there's also, alternatively, sometimes parents don't think they're doing a good job because of how they feel, but I can actually see that they're very attentive and they're doing a great job. But because the disconnect that happens with anxiety and depression really clouds how you see who you are, what you're doing, and how you're interacting with your child. And so sometimes the repair and therapy is showing them that they're actually doing a good job despite how they feel.
What is like the time frame? Because you mentioned even being able to have some of the symptoms during pregnancy. And then you just mentioned like 4 years. That's shocking to me.
When we're looking at perinatal mental health conditions, I'm looking at just from reproduction, like when people are starting to try and become pregnant, and that can include IVF, through just spontaneous pregnancy, birth, loss, unfortunately, perinatal loss, and postpartum. And the onset of symptoms can happen any time in that range. If you're looking at like a DSM or diagnostic manual, what they show in there is a much shorter time frame. But in the field, we know that symptoms can have an onset anytime in the first year postpartum. And so if somebody is coming to me at year 4 or something like that, I want to really look back and see when did the symptoms start, because they can start. It doesn't necessarily always happen in the first couple of weeks. There can be a trigger like after stopping breastfeeding. Some people, for whatever reason, the hormonal shift in there can bring on depression, can bring on anxiety.
It's so funny because we know people that have tried to conceive, and as they're trying to conceive, and some of them are unsuccessful. And I just think about like all of the stress going through that. And for me, this is the same thing. This is perinatal depression, right? I mean, this is because you're going through such a difficult time because you're taking something that can happen naturally, but again, you're just trying and trying and trying. And
Yeah, that people don't necessarily know that postpartum depression can happen after a loss. It can happen after a miscarriage. We're usually thinking of like full-term pregnancies or even people whose babies are born prematurely, go to the NICU. You associate that a little bit more that, okay, yeah, they're probably going through something, but it can happen at any point.
Now it's time for What's the Buzz, presented by BuzzRx. Every week, I answer a health-related question from one of our viewers. This week's question: Hi, Dr. Rutland. I'm a new mom, and my doctor mentioned antidepressants for my postpartum depression, but I'm still breastfeeding. Is that safe? Do I have to choose between my mental health and feeding my baby? This is a great question. Totally understandable that you're worried about the health of your baby, especially when you're a new mom. And because depression can be common during the postpartum period, it is important to take care of your own mental health. The research tells us that the risk to your infant's health is low when it comes to antidepressants. SSRIs, selective serotonin reuptake inhibitors like sertraline, have been the best studied class of medications in relation to breastfeeding. And it is really important to remember that healthy parents are the key to healthy kids. That's the buzz. If you have a question, email us at thehealthexchangepodcast@gmail.com. Thanks again to BuzzRx. Look up your medications on buzzrx.com or the app to see how much you can save. Have you ever counseled a couple that's going to go through IVF and say, I don't know, the one of the partners was hypervigilant and just had heard about this and was like, I really think we should see somebody about this before we kind of go through this. Have you ever counseled a couple that's going through IVF?
Mostly just the mom is who I see for.
But you have seen a mom that's going through that
Oh yes,
process.
for sure. I always invite the partner in. Once I moved into doing online therapy, couples therapy became a little harder to do, but I always invite the partner in. Whether they come in or want to come in is another thing, unfortunately. But definitely it is impacting both people. I mean, fathers experience loss, same-sex partners experience loss, trauma. The loss happens to the family, and the stress happens to the family. There's, hormonal changes and medications and shots and doctor's appointments and all of these things. There's really no way that doesn't stress and put stress into the couple.
If we had another kid, would you think about this differently? Like, how would what we've talked about for the last 40 minutes or so, would that impact how we went into it?
Oh, I would do things completely different now. I would have a therapist. I would have, we would, I don't know, we would have a whole thing going on. Like, you sleep, I sleep, we're all sleeping.
I mean, that's after all, it is, it's a system. And if one part of the system is having a hard time, it puts pressure and stress on the other part of the system. And so finding a way for as many people in the system to be getting what they need is what's best for the family, really. And, we talk about having balance in our lives and all that. That's great. And you can have that sometimes, but that's not always the case during this period of time. It's a huge life change and transition into, especially if it's your first, you're like, what in the world? You don't expect half the things that are happening. Everyone's trying to adjust. And oftentimes people adjust in different ways and at different times. And that's a lot of times what causes stress within the couple. Let's say you had postpartum depression, you were experiencing it, but you got help, started to feel better at about 6 months. You might have been like, all right, I got to buckle down, hold on, do what needs to be done. But you're feeling stressed too. So as soon as you start to feel better and like you're lighter and you're okay, then you start to feel the stress, like the depression can start to come on, because that just is known to happen within couples in this period of time. And so if you're depressed, you're like, oh my gosh, why doesn't he get it? How come he can't see it? He might be in just a total different mentality. And then you get depressed and then you're like, oh, why is he depressed? I'm the one who went through it. But I hear this stuff a lot. That's why I say it like that. The reality is the stress could be on both. Not always. But if you, again, as an example, were to have had postpartum depression, you're like 50% more likely to also have it.
Well, and it's probably really hard for men to even admit it. For one, like you just said, they weren't the one that had the baby.
Mm-hmm.
So there's probably some like guilt, or I shouldn't feel this way, or I shouldn't do anything.
That's
I'm not
one
going
of
to
the
bother
examples.
anybody with this.
Mhm.
Because I would have never, I mean, that's new information to me.
I remember the week that we had our first, and my wife doesn't really know this. I've never really actually told her this story. But a couple days before our first one was born, or when they were scheduling to induce her, because she had gone like kind of like a week over, I think, something like that. Oh, no, I can't remember if it was a week over, a week early, whatever it was. I go in, I'm a fellow, I'm a pulmonary critical care fellow. And I go in to our fellowship meeting with our attendings. And I had just heard that my child was like IUGR, like intrauterine growth retardation, right? I knew that she wasn't growing as well, right? And I'm like kind of dealing with that, but I'm a pulmonary critical care physician. I'm like, well, you know what? Like my wife's not dying in the ICU, like no big deal, like whatever, I can deal with it. And I remember announcing it, and I was like, you guys, my wife is due where she's going to be induced. Somebody needs to cover me in the ICU next week. I don't know who's going to do it, but I'm not going to be here. And they all looked up at me like in shame, like I wasn't supposed to like I shouldn't have even asked, like, right, I should, whatever. And I was just kind of like,
Those can't have a day off.
right. And I was honestly like in this state of like loneliness, shock. And like, I went home and I like sat down and I didn't know like what the hell I was feeling for a second, because I had never felt that way in like my life. Like,
Right.
and I was just like, what a bunch of fucking assholes. Like, I am
Right,
still
right,
like,
right.
I am still pissed about it. And I
Yeah.
remember looking at the person who could have easily covered me, who was in my class. And this person was like, no, I'm not going to, whatever, blah, blah, blah. And I was like, I'm out. Like, I'm not doing this. Right. And I was just like, man. But 3 years later, that person got pregnant. And I was like, yeah,
Mm-hmm.
a lot different, isn't it?
Now what?
Like, oh, now you get it, don't you?
Right.
Right. But I mean, it was
Yeah.
just like one of those feelings. And so, like, for me, when you talked about like non-carrying parents or fathers, right, having these feelings, and it's perfectly maybe normal and okay. And what should they watch out for? Now, I know there's this really complicated word that you read all over the place called anhedonia. All it means is like you don't have pleasure, like you lost your pleasure. We always come up with really strange words. Obviously, that's one of the things. But is what else should those non-carrying, and by non-carrying, I mean the people who do not have the baby inside their body, non-carrying parents should have?
Yeah, thanks for sharing that. I think a lot of people can identify with that just because there's so much pressure, not only in your profession, but for the person who's not carrying. Like you're not supposed to have any needs, I guess. So there are some things, for instance, like depression in men often shows up more as like angst or anger, as opposed to like down or downtrodden in some ways. And for other non-caring parents, same-sex partners, adoptive parents. I mean, there are all kinds of things that can happen in the birthing room, like the parent being left out, not being counted in the process, sometimes being left out altogether, or experiencing some kind of implicit or explicit bias, bigotry, those kinds of things that can leave people feeling disconnected. And there's also a focus in a way, yes, to the baby, mostly, but to the birthing parent gets a lot of the focus. The same-sex parent can be just feel really left out and alone, and not, could potentially feel like there's nobody to talk to or nobody's on their side. And I mean, my mind is going into a million different ways that this can happen, and develop for somebody who is intimately involved in the process and is seeing their child being born and wants to be involved, but is being left out, and left to the side. It can be devastating.
Telling us all of that, how do you support that? Because for me, when I think about who's in the room, right? You've got the physicians in the room, you've got the nurses in the room, you got all these individuals in the room who probably haven't been educated on postpartum depression or postpartum mental health disorders at all. Like, how do you best support that scenario? What can you do?
Ideally, if there's prevention in place for the couple to come in and get support on how to navigate that system, and have a doula who has trauma informed, ideally, who is aware and can help navigate the systems that are in place. Usually, doulas are familiar with hospitals and doctors if they've been working there long enough, and can be like, oh, that doctor, he's this way, or this doctor, she's that way. And can be a little bit of a buffer and help the non-birthing parent navigate and empower them also to speak up and be involved.
You said a doula?
A doula.
A doula. Okay.
There's lots of evidence, numbers that I don't have off the top of my head about how supportive having a doula can be in the birthing room, both for the birthing person and non-birthing person.
And then how do you find a doula? Do they work for the hospital, or is it something you find on your own?
Some hospitals have doulas who work within the system. Oftentimes, a doula is hired from outside. They'll have their own kind of practice and interview them to see who fits, your vibe, and who can support you through the birth process that you want to have. It's kind of like finding your best match.
When we start talking about doulas, and we're talking about, people being informed of perinatal mental health conditions, this really gets down to access, right? Access of care. And whenever we start going down that path, I start thinking about healthcare disparities, amongst people that look like me, especially when you look at, Black women in terms of health, especially in terms of birth. Like, we have higher death rates, right? We have all of these things. So it's probably no different in perinatal mental health conditions. I'm sure we probably have higher rates from what I'm seeing too, right?
If you're looking at general population's chance of having perinatal mental health condition for women is about 1 in 5, or let's say 20%. For women of color, in particular, Black women and Latina women, it shoots up to about 40%.
Wow.
Which is a huge, that's like almost half the population. And those are people, let's just say, that we can sort of count, that have, in our statistics. That's not counting the people who have like maybe a subclinical presentation and they don't meet every criteria for, a perinatal mental health condition like postpartum depression. But even if you don't have depression or anxiety, it doesn't mean you're not impacted by the change or the system that you gave birth in. The rates of maternal mortality are much higher for Black women and Latina women, and frankly, a lot of women of color. So the rates of perinatal mental health conditions are much higher. And some of the reason for that is racism, honestly, systemic racism. And as I mentioned before, implicit, explicit bias. There's a long history of it pains me to say it, but using Black women for experimentation, for gynecology in particular, and wherever that thread started, it still is in there. And it's hard to share that statistic because it's also scary to hear that statistic. If you're a Black woman who's going into birth, and that stat, then it automatically increases your stress.
Yeah.
Because you're worried about that. So having providers that look like you, or having trauma-informed providers, finding people who can support you like doulas, getting connected with organizations that support Black and brown women in their birth. And those are all ways to help reduce that fear.
It's so funny. And I think you heard my mom talking about this at some point. When I was born, and my dad is drug addict, right? And so when my mom was a single mom, when I was born, like, I guess my dad was like gone, like nowhere to be found. And I'm sitting here thinking about it, and I'm like, oh wow, like we were in Florida, and my mom was there like by herself, like no family. My mom makes a phone call to her dad, and my grandfather's like, that's it. And then my grandma comes and they move, my grandma says, okay, you're moving back to Sacramento, right? I mean, I'm just thinking about all these things, all these like situations and scenarios that I have never given thought to that contributes to my mom's mental health during that period. And honestly, like, from my mom's perspective, from my perspective as an outsider looking into a specific scenario, I'm like, damn, my mom was kind of a badass to be able to handle all of that and to continue to strive through, but like
Mhm.
she shouldn't have to.
Right.
And there should be support.
There should be. I mean, there's not enough support across the board, for sure, which is why I'm glad you guys are covering this.
You said earlier, and I'm so happy that you said it. You said like it's just racism, right? I mean, it's like that's it. It's so when you look at literature, especially on healthcare disparities literature, like all these individuals that publish that literature, they show the gap. They show the gap. They publish the gap. Every day they publish the gap. But they don't offer solutions.
Yeah.
And it's so interesting to me. Even when I'm a guy that presents a lot at international conferences all over the world. And when I present healthcare disparity data, I'm presenting the data. This is a problem. This is the gap. But when I'm talking, and whoever I've worked on the slide deck with, I'm not allowed to state solutions because the solutions aren't evidence-based. So I just kind of state it, and I don't. So like a lot of like I'll even tell you, like I got in trouble once because I was just like, here's a solution, right? Have providers that look like you, or make sure that if you're in a neighborhood like Long Beach, right, where there's a lot of individuals of color, but the area is extremely polluted in terms of air, make sure that there's access to pulmonologists that can treat these individuals that have asthma because there's high rates of asthma, things like that. Like I'll get like slapped on the wrist, like, oh, you don't have evidence to prove that. And I'm like, what are you talking about? This is common sense. Right?
Right. Yeah, it is obvious.
Yeah.
It is obvious.
We spend a lot of time discussing the thought process that surrounds perinatal mental health and postpartum depression and depression in general, really. I guess what we really haven't done is we said, hey, listen, like if you have these specific symptoms, or if you say yes to this question, this is when you need to watch out for it and go see a mental health professional. Tell us.
So thankfully these days, pediatricians are offering screenings, like the PHQ-9 or the Edinburgh Postnatal Depression Scale. OBs are too, but typically if there's, an uncomplicated birth, they're seeing their OB for 6 to 8 weeks and then they're released to their primary care. Pediatricians are the ones who are seeing the moms more frequently. So that's a really important shift that's happening in pediatrics to, just because it's not the patient directly doesn't mean it's not impacting the patient. So yes, screening tools can be helpful as a screen. It's not giving you the total rundown of what all they're experiencing. It's just saying like, hey, look out for this. So if somebody is going to their doctor's office and getting the screen, ideally the doctor's also telling them what the score was and giving them resources to therapy or online support groups. One thing I want to mention is it's more than just depression and anxiety. As I mentioned, there's perinatal OCD. There's a bipolar disorder, sometimes onset postpartum. 50% of bipolar disorders in women show up in postpartum. And there's postpartum psychosis, which if there's an active psychosis, that's a medical emergency. So when we're talking about diagnosis and what that looks like, that covers quite a broad range of conditions. As I mentioned before, we're looking at intensity of symptoms and duration of symptoms. So if anything is, if you're experiencing like depression, could show up as sadness, tearfulness, that anhedonia, not wanting to do anything, changes in eating and sleeping, which is hard because it's already shifted in postpartum. And especially if there are more severe symptoms like suicidal thoughts, or even what I would describe as escape thoughts, like I don't want to be here. I don't want to die, but I don't want to be here. Those are more severe symptoms, and ideally should get referral to a therapist or a psychiatrist as soon as possible. Things like anxiety will be like the vigilance I mentioned before that I experienced, agitation, constant worry that's hard to set aside. It can show up in lots of physical ways, like changes in breathing patterns and heart rates. Like really kind of shallow breathing is what a lot of people experience with anxiety. So this is a worry that it could be generalized to like everything that's going on, or it could be hyper focused on just baby or something in the environment. If it's OCD, then you're looking at a pattern of obsessions and compulsions. So if I were to take my example, I was obsessively worried about my daughter's breathing. And my compulsion was that I had to check. I had to make sure she was breathing. I had to touch her belly and make sure it was rising and falling. I couldn't be okay until I did that. So it's not like, oh, I'm worried about it, but I see it and I'm good. That's more of what an OCD presentation is like. Bipolar disorder can go between depression and mania or hypomania. And depression, I already talked about a little bit with the down, sad, depressed feelings. But mania can look like really high energy, talking very quickly. There's one woman in particular who had what's called hypergraphia. She was constantly writing. She couldn't stop. And so changes in behavior, changes in like what you would consider personality might be more associated with a bipolar disorder or postpartum psychosis. Psychosis often shows up in the first couple of weeks, but it can show up anytime in the first year. Psychosis is when somebody's experiencing hallucinations, delusions. What's really difficult about psychosis is that symptoms can wax and wane. So at some point, somebody can um, seem very lucid and together and there and present, and then at another point be like withdrawn and distant and kind of responding to internal stimuli, if you will. They may be saying odd things or having odd behavior that is outside of their norm, but it is an emergency because the vast majority of people who have a postpartum psychosis, they might know something's not right, but they don't actually know what's happening. So they've sort of separated from themselves, and that can be dangerous for them. And unfortunately, the cases that you hear about in the news of postpartum psychosis that involves infanticide, those out of the 1 to 2 in 1,000 people that will experience postpartum psychosis, 4 to 5% will go on to suicide or infanticide. Sort of a relatively small number within the postpartum psychosis numbers. However, it's a risk. It's a risk. So as soon as you experience something like that, get somebody to a doctor right away.
I think it's really interesting. I think like after just talking to you, and hopefully like this is for a lot of people that will watch this, it's like it's like I go back and I'm like, oh, I definitely think that I had like postpartum anxiety for sure. Like there were times like our oldest Amelia was born September, and then that horrible like Sandy Hook thing happened a couple of months later.
Yeah.
And I was just obsessive about watching, like it just really took over like my whole emotional health, which I'm sure it did for a lot of us. Is terrifying and very sad. But like just right after having a
Yeah.
baby, it was one of those like I couldn't get away from it.
Absolutely. And
So
you of course it did. It's terrifying. And what you're saying is true for it's true for a lot of people. Like when there's natural disasters, when there's, horrible stuff happening in the news, it does increase our anxiety. And it's like a really good reminder to check in with people who just had babies. Like the pandemic, like rates of anxiety were so high because of course they were. Whenever there's something going on, even in the world, that puts you in a more vulnerable place, then it leaves you more prone to anxiety. So it makes sense.
so speaking about that, like for me, I have a little bit of an avoidant personality anyway, so just turn the TV off, try to go do something else. That helps me. But like what are some things that people, women, men can do to kind of combat some of these symptoms?
So community, or at least having one person that you feel close, comfortable with sharing, is really, really important because most people experiencing any of these conditions feel isolated, feel alone, possibly scared, confused. And it's hard to talk about. So like reaching out to that one person even that will listen and not judge. And if you don't have that person in your life, reaching out to a perinatal mental health trained therapist, somebody who gets it and can support you in the right way. There are a lot of free resources. And Postpartum Support International is the leading nonprofit for perinatal mental health. They have free support groups running all week, and it's all online. So to your point, access. that type of support, being able to hear other people having the same experience as you, maybe saying something that you're experiencing in a different way to help you understand yourself better. These are really powerful ways to get help. Therapy is incredibly helpful because even though the symptoms might be the same for people, how you get there could be unique to you. Like I said before, if there's a trauma history, or if there's other things happening that you need help with understanding, it, therapy can be a good place for that. Therapy alone for maybe mild to moderate symptoms can be enough. But if your symptoms are in the range of moderate to severe, then oftentimes we're suggesting medication as an option as well. And there are, plenty of safe SSRI medications that people can use and often need. And I find that people who are experiencing OCD and anxiety have the hardest time with wanting to try medication because they're anxious about medication too.
Yeah.
But I've seen it just shift people relatively quickly. It can take 4 to 6 weeks to really kick in. But the amount of relief that I've seen people have from starting a medication so that they can think more clearly and be present and then work on the things that may have brought them in, it's for some people life-changing.
So a lot of times, this is a small confession. All right, I've been in medicine since 2005 when I started medical school. But every time in psychiatry and psychology, when you get to the test and you get to a test question, and you're like, hey, what's the answer? What's the treatment, right? The answer is always cognitive behavioral therapy and treatment. And I swear to God, to this day, I have no idea what cognitive behavioral therapy is. Like, I'm admitting that completely freely. I have no idea. What is it?
Right. Nice. Right. So, yeah. Cognitive behavioral therapy and interpersonal therapy are evidence-based therapies for perinatal mental health conditions like depression and anxiety. So, cognitive behavioral therapy helps you take a look at your thoughts, feelings, and behaviors and how you're impacted by them and how you can intervene with them. So, for instance, let's say we would find something that's called like a trigger or a pain point. And let's say it's...
Can you do it right now? Can you like just say, what's your pain point, Jamie? And I'd be like, I don't know, when my 10-year-old talks back to me, like whatever it is.
Is there something that consistently makes you feel, maybe, let's just start with worried?
I worry that my 10-year-old looks at the screen too much.
Okay. So when that worry comes in, what is the first thing you think about in relation to that?
Breaking her iPad in half.
Okay. Okay. That's a behavior. No, you're thinking about...
I'm thinking about breaking
more specifically, like what is a worry that you have that would come from that?
That she doesn't gain the attention, the personal attention required to be a successful and positive contributing member in society.
And how do you feel about that when you say that?
I feel like I'm not doing my job as a parent and I failed.
And what does that make you want to do?
Break the iPad in half.
Okay, there we go. Okay, so let's say you did break the iPad or whatever, something like that. What do you think you would think after that? What would be a thought after that?
Oh, God, I hope Dorey didn't see me break this iPad.
Okay, now you're worried.
My initial thought, honestly, would be like, all right, cool, problem solved. But then I would be like, I created this problem. Like, how is me doing what I just did going to adjust what I need to do in the future?
Okay, so just taking that snapshot and looking at the worry for now that came in, we're looking at thoughts, feelings, and behaviors and how they're impacting each other. If you're in sort of a stress spiral or anxiety spiral, that can go downhill pretty quickly. And you can end in what would be at the most base thing you would feel about yourself if you let her continue watching the iPad.
Failure as a parent.
Okay. So then we're getting into what this isn't exactly CBT, but then we could be getting into what are called core beliefs. So we're trying to understand what are the beliefs you have about yourself that are in some way shaping your thoughts, your feelings, your behavior in relation to stress. So then what we're trying to do is, like a really quick skill that is like a CBT skill is called catch it, check it, change it. So if you find yourself having like a judgmental thought about yourself, like I'm a failure for not getting her iPad away from her, our job would be to catch yourself saying that, check it out. Like, is there actually evidence that I'm feeling her? No. So then you would change it. So what would be a neutral or even a positive statement that you could say instead? I'm doing what I can do right now. Or like, yeah, we're going to have a system in place soon. That kind of a thing. So you're trying to keep your mind from going into what are called thought distortions, the shoulds, the always, the nevers, these ways that our thought processes become distorted with stress, to stay out of that. Because if you have the tendency to, like, let's say, always judge yourself for something, you're gonna feel bad. There's no way if somebody else was walking around telling you what you tell yourself, you want to punch them in the face.
Yeah.
I think it's usually mean when it gets to that point. So we're trying to like catch that, and change how you talk to yourself, change how you think to yourself.
That's interesting.
One thing, it just brought up something else. Like one thing somebody told me that I thought was just this like tiny phrase, but so impactful. And I think like new moms or dads could really benefit from it, is that they said, just tell yourself, because I went through some medical stuff and it kind of made me all nervous and all this stuff, right? And they said, just right now in this moment, just say, today I am okay. And it's like, if you just say that, like, today we're okay.
Yeah.
Like you and me, this little baby, our little family, today we're okay. I don't think about tomorrow.
Right.
Yesterday we were okay.
Right.
So
Absolutely.
it's just like, instead of this like big giant thing you're tackling, it's like just right now.
Yeah. Absolutely. That's really useful. It's mindful, it's grounding, it's bring yourself into the present moment. Because it's really easy to future trip this, like, what is happening way out into the future. But that is a perfect example of grounding.
So break the iPad in half and then just say, today is okay.
Now we're okay. Now we're all right.
Now we're okay.
YouTube is not, but we are.
Right, exactly. So what do you think is the best way to talk to people like about this in general? Maybe we're out of the whole friends having new baby phase of our life, but like, how would we bring it up? Like how should we do that? Like, when you go to dinner with friends and they're talking about like having a baby, say you're going to dinner with a young couple or something, do you bring it up?
I might be that person.
You are.
Yeah, I might be that person. I'll kind of dance around it a little bit.
Bro, are you depressed? Like,
right. Well, people know what I do, so they'll start telling me all kinds of stuff. But I'll do like little mini PSAs, like, hey, I know you're good right now, but sometimes these things can happen. It's just like good idea to keep your eye out on it. If you want any more information, I'm happy to share. Or what helps the most is if I share something personally. Like, I didn't expect to feel like I felt after I had my baby. And like, if you do too, just know that it's common, not necessarily normal, meaning like you shouldn't be feeling this way, but it happens to a lot of people.
So when you went through your experience,
Mm-hmm.
postpartum, and you were like, oh man, I figured it out. That's what it was. Were you just like, hey babe, come here. Do you remember that time I slept in the refrigerator shut? I was just depressed. Like, I just figured it out. Like, how did that go with your spouse?
No, not right away. I didn't. Because there's also, we didn't talk about it too much, but I alluded to it. There is so much shame in this. Because you're not the all-star mom or parent that you thought you were going to be or told you were going to be. So and shame is silencing. So I had to release that first before I could start talking about like, hey, I think this is actually what I've been going through. Sorry, it was probably hard to live with me because I was internally preoccupied with all of this stuff that was going on. So
and faking it.
I deserve an Emmy or whatever people get for that.
Really appreciate everybody joining the Health Exchange today. I got to say thank you to Dr. Kat for being here. Also, thank you to Dorey Rutland for accompanying me here in the studio. Really appreciate talking about perinatal mental health, therapies, pathophysiology, all the things that I love to talk about. But as always, we like to end with a positive pulse, a positive outlook, a positive story about something that we talked about today and how it affected somebody's life in a very, very positive way. So, Dr. Kat.
Thankfully, there are a lot of positive outcomes. It's my favorite part of being a therapist is seeing somebody turn the corner. And I recently had a mom in my practice who was really, really deeply struggling with high anxiety. It was relentless. And she couldn't see what I already knew, that she was going to get better with the right help. My job is to hold hope for people who don't have it yet and keep encouraging them. And so that was part of the work that we did, like getting her skills, helping her cope better in her life, getting medication. And she came in online one day and she herself noticed the shift. She herself said, I think I can see that I'm going to get better now. And I was like hooting and hollering. I was so happy for her because she could see it now too. And it's so amazing how much transformation can happen, especially going from not thinking you'll ever feel like yourself again to being like, yeah, I think I can do this, is the most amazing thing.
That's awesome. It's a great positive pulse.
I know everybody's going to want to know how to find you. You said you do online. Is this nationally? Can you speak with anyone?
No, unfortunately only within the state of California because of licensing laws, but anybody in California. My website is wellmindperinatal.com, and that also houses my podcast, Mom and Mind Podcast. I also volunteer with an organization called Postpartum Support International that I mentioned earlier. The immediate past board president, and I'm now just on the board as a board member. This organization, postpartum.net, is amazing. There are free resources, like I mentioned before, online groups of all kinds, whether it's postpartum depression or anxiety or post-loss, or if you're looking for a specific group in Spanish. They offer a therapist directory for nationally, where you can find a trained perinatal mental health therapist, and are just generally at the forefront of all things perinatal mental health. So I'm affiliated with them and been working with them for years.
That's amazing.
Thank you so much.
Thank you for having me.
It's okay to ask for help. So just ask for it. Thanks you guys for watching and listening to The Health Exchange. We're on Instagram at The Health Exchange Podcast. Also, we're on YouTube, wherever you get your podcasts. You'll see us every Thursday at 9 a.m. Eastern, 6 a.m. Pacific. We'll see you next Thursday.